The following scenario is intended to promote reflection and discussion about communication practices that move towards relationship building. In this instance, an elder has been admitted for end-stage COPD, and Dr. Jones, a locum physician, has just entered the room. Dr. Jones is acted by an actual licensed physician. As you watch the segment, consider the following questions. What is happening? What issues does it raise? What emotions come to your awareness? What implications does it have for how we practice?
Hello, Mrs. Whitehawk. I'm Dr. Jones. Dr. Murphy's asked me to look after you while he's away next week. Do you mind if I sit?
Sure.
So, how have you been feeling?
It's getting worse. I can't breathe without oxygen. I know I'm getting very ill.
You say very ill. Can you tell me more about that?
Well, I know I'm not getting better. Maybe it's time to call my daughter to tell my family what's going to happen.
I think that's a good idea. It's hard to know where things are really going to go.
Thank you, doctor. Where do you think it's going to happen now?
Well, you could stabilize or improve slightly if we're lucky.
Well, is there going to be lots of pain?
It's going to be mainly hard on your breathing. We'll do everything we can to make sure you're comfortable. Make sure to tell the nurses, though, if you're uncomfortable.
Oh, thank you, doctor. We'll see how we make out.
In reality, it will usually take more time and trust to move to the kind of engagement that was witnessed this quickly in the scene. It's important to explore with a patient the kind of relationship that they want with their primary care provider. Due to the harshness of past institutional experiences, some people will remain distant, allowing only minimal relational involvement. Others will want a more humanist and relational approach. It will be difficult to determine individual preferences, however, until such time that a functional initial relationship has been established. Gentle tone of voice, a willingness to sit with rather than tower over, and communicating a genuine sense of concern about a patient's welfare can be helpful for initial engagement so that conversations can proceed about their expectations.